expenditures. Now, when we look after the health of Canadians, we invest in their health and well-being. We protect them, we promote their health, and we make those Canadians not only live better lives with greater well-being, but also more productive and healthier for a longer time. So healthcare expenditures in Canada account for about 13% of total GDP. Investing in the healthcare sector is a great source of increased productivity, not only obviously for the productivity of those workers that we care for and therefore make them able to live better lives and be better at producing goods and services, but also because of the healthcare investment that we make generate knowledge and innovation that benefit other sectors of the economy. Healthcare investments will be key to keep growing our economy in the short and in the longer term.
Public-private partnership, which works very well. And this is a model that's required to continue to help alleviate growing demand as our population increases. This collaboration that I talked to between the various groups was truly unprecedented. It was between it was government agencies, vaccine manufacturers, testing laboratories, collection networks. And this actually enabled us to reach a rapid scaling, which was required to meet the demands to manage the pandemic. One key lesson that we all learned was the need for humility. And we all saw the need to continually learn, and this has never been clearer, so that we can continue to adapt to today's crisis and prevent the next one.
We all have key roles to play together to evolve our system, pandemic-proof it, as I like to call it, and bigger than that, ideally create a more sustainable and integrated model for the future. A lot of politicians, a lot of policymakers, a lot of industry leaders speaking of just the value of this collaboration and the fact that we might have figured it out. We ultimately need more resilience in healthcare, not just for the health benefit of Canadians, but to shore up the broader economy.
The how, in terms of ensuring life sciences sector becomes a more powerful driver of economic recovery and growth, it already exists. We don't need to recreate it. Canada to become a critical and important part of the global supply chain. We should not be focusing on or creating policy that smacks of domestic isolation. It's a global industry, it's a global pandemic. So what is Canada's sweet spot? We have to recognize other countries are engaged in really exactly the same exercise we are regarding trying to build up that life sciences footprint in this very competitive global context. And we've got to find a way to stand out among many competing countries.
If we're serious about building an industry here, we need to build a policy framework that encourages the translation and the scale up of companies here within Canada, both from direct investments from the government, but as well as policy and other non-monetary incentives that ensure that companies can grow and scale here. It needs to be about building the grassroots of the sector as well, so that those companies have reasons to stay here, so that we can build out the next great unicorns out of Canada in the life sciences space.
The way the industry, together with a partnership of different stakeholders, they were able to bring vaccines at scale, at speed, has been incredible. Solving such a big problem needs to really, needs to bring, the right people around the table. So I think it's important really that we mobilize, the right stakeholder to solve for the right problem. The approach we took, I'm optimistic because I think, what has happened with COVID is really shifting the perception of investment in healthcare system as value and not cost.